Pediatric Rheumatology Last-Minute Flashcards. A 7-year-old with morning stiffness, knee and ankle swelling for the last 2 months. ESR is normal and anti-nuclear antibody or ANA is 1 to 160. What is the most likely diagnosis? Oligoarticular juvenile idiopathic arthritis or JIA. The diagnosis of JIA is based on the length of symptoms. Arthritis 6 weeks or longer will make the diagnosis of juvenile idiopathic arthritis, even if all labs are negative. A 9-year-old girl recently diagnosed with JIA. Her ANA is negative. How frequently does she need screening for uveitis? Every 6 to 12 months. JIA in a child more than 7 years of age and negative ANA will require follow-up with pediatric ophthalmologist every 6 to 12 months. 8-year-old boy with difficulty walking for 2 days. He had an influenza virus infection a week ago and has no fever. On physical examination, there is muscle tenderness, especially in the calves. The creatine phosphokinase level is moderately elevated and urinalysis is normal. What is the most likely diagnosis? Benign acute childhood myositis, commonly not associated with rhabdomyolysis, can be triggered by influenza infection or viral infection. A 7-year-old boy with pain in both legs, worse in the evening, sometimes awakens him from sleep. No fever, no limping, joints are normal in exam. Pain responds to ibuprofen and heat massage. Growing pain. Growing pain is a diagnosis of exclusion. Most important points: no joint swelling, no limping, and no fever. Newborn infant presents a few hours after birth with hypotonia, facial muscle weakness, ptosis, weak cry, respiratory distress, and mother has a history of muscle weakness. Neonatal myasthenia gravis. Keywords: hypotonia, after birth, ptosis, and weak cry. Of course, maternal history will make the diagnosis easier. Child with fever for 3 to 5 days every month, associated with mouth ulcers, throat pain, cervical lymphadenitis. The patient is well in between episodes. This is a case of periodic fever, well known as PFAPA. PF stands for periodic fever. In this case, we have fever for 3 to 5 days every month. A stands for aphthous stomatitis, mouth ulcers. P stands for pharyngitis, throat pain. A stands for adenitis, cervical lymphadenitis. The treatment is symptomatic treatment. There is no cure. But giving a single dose of prednisone 1 to 2 milligrams per kilo can abolish a febrile attack within few hours.
Having trouble or trying to pass the pediatric board exam? We have the definitive solution for you, presenting the Last-Minute Review Series, a powerful tool for achieving success in pediatric board exams, crafted by Dr. Osama Naga, a board-certified pediatrician by American Board of Pediatrics and the editor of the Pediatric Board Study Guide, a last-minute review. Dr. Naga breaks down the most critical subjects in this series. The Pediatric Last-Minute Review webpage offers a thorough and rigorous set of pediatric board review sessions that are in line with the study guide. The lectures will cover the most important topics for each condition that a pediatrician must know for pediatric board exams, as well as real-life clinical encounters. The inclusion of a clinical case scenario, accompanied by multiple-choice questions, followed by the most probable answer and a comprehensive description of the issue, will ensure test readiness for each student. You will be able to download the lecture's PDF files to make your studies easier, to take notes and be accessible on the go and offline. Based on the membership plan you choose, you will have unlimited access to the lectures for either 1 month, 3 months, 6 months, or 1 year. By viewing these videos, you will increase your chances of passing the board exam and gain substantial advantages from the acquired knowledge. Additionally, by studying the material and completing the AAP prep questions from the previous 3 years, you will greatly increase your likelihood of passing the board and will acquire a wealth of knowledge. Click on the link provided below to visit lastminutepediatric.com and subscribe immediately. Be sure to take advantage of our free video samples on our YouTube channel, Pediatric Board Last Minute Review. Good luck with your exams.
This is the end. Thank you.